One of the biggest concerns for patients with rheumatoid arthritis or other autoimmune types of arthritis is, if I need to use a biologic medication to control my disease, does that mean I have a higher risk of developing cancer? In this video, I will present the latest reassuring scientific data on this topic. I'm Dr. Hatem Eleishi, consultant rheumatologist, and I also provide online consultations for patients with arthritis. Let's dive in. Which biologic medications are in question? Not all biologic medications used for the treatment of rheumatoid arthritis have been accused of a possible association with a cancer risk. Only certain biologics, the TNF inhibitors family and the JAK inhibitors family. You can see the names of these medications on the screen now. However, other biologic medications such as Actemra, Orantia, and MabThera have not been linked to an increased cancer risk. In fact, MabThera is one of the medications that is actually used to treat some types of cancer. Now let's go through the research on the TNF inhibitors family and the JAK inhibitors family, the two families of medications that have been questioned. TNF inhibitors, are they linked to cancer? TNF inhibitors include Enbrel, Humira, Simponi, Cimzia, Remicade, and their biosimilar medications. When these medications were first introduced, there were concerns about a potential increased risk of certain cancers, particularly lymphomas, cancers of the lymph nodes, and leukemias, cancers of the blood, and certain types of skin cancer, especially in people with fair skin, called melanoma skin cancer. Because of these concerns, the US FDA issued warnings in the past about those medications. However, long-term studies and large-scale studies and analyses have not consistently confirmed a significant risk. Why has no definite link been found? Research has shown that patients with long-standing active rheumatoid arthritis already have a slightly increased risk of these cancers, whether they take a TNF inhibitor or not. This means that the disease itself, if uncontrolled for many years, could be the real factor, not necessarily the medication. Importantly, if your rheumatoid arthritis is well controlled, your risk is likely very low, if any. Also, solid cancers like breast, lung, or colon cancer that do not seem to be a complication of long-standing active rheumatoid arthritis also have never been shown to be linked or associated with the use of TNF inhibitors. What we mean here to say is that only the cancers that could be related to long-standing active disease are the cancers that could happen here, nothing else. How about JAK inhibitors, the second family? The second group of medications in question, the JAK inhibitors, which include Xeljanz, Olumiant, Rinvoq, and other more newer medications. Earlier studies raised concerns also about a possible link to certain cancers, such as lymphomas and skin cancer also. More recent data is less alarming, but there is still some caution, particularly for older patients. Additionally, in smokers, JAK inhibitors have been associated with a higher risk of lung cancer. All in all, the benefits of a JAK inhibitor, such as reducing inflammation, preventing joint damage, and improving the quality of life, often outweigh the potential risks, especially if other treatments haven't been working for you. So the conclusions here: number one, the overall cancer risk associated with biologic medications remains low or very low. Number two, if any caution or extra caution is to be considered, this should actually relate to the personal or the family history of cancer. Actually, this should be the real concern, not the biologics and not the disease that is under control. Number three, the decision to use biologics in all cases should be always based on balancing the benefits versus the risks. Alternative treatments may be considered for high-risk individuals. Number four, regular cancer screening is important, but again, keep in mind that the biggest risk factor for a cancer is a strong family history, not rheumatoid arthritis, not the biologic medication. I will leave some of the important references for the data in this video in the comments section below. If you have any questions, please drop them in the comment section and I will respond to them. If you have rheumatoid arthritis and you like to receive a PDF file with the super details of the measures you need to follow to stay safe and to limit any cancer risk, please send a WhatsApp message to the number seen on the screen and write "Stay safe from cancer," and they will send you the PDF files. Thank you for watching, and if you found this video helpful, don't forget to like, share, and subscribe for more expert insights on arthritis and rheumatology. See you in the next video.